And we are back on the WHHI-TV Daily News. With me now is Dr. Mathai. He is a director for Delta Dental, and we're here talking about oral health today because it is Oral Health Cancer Awareness Month. Easy for me to say this morning, but that's what April is. And so let's talk a little bit, Doctor, if you would, about some statistics going on around oral cancer right now, because really it's kind of pretty prevalent at the moment.
Betsy, thanks for having me. Yeah, a lot of people don't know too much about oral cancer, but around the world, there's about 500,000 cases new every year. In America, about 50,000 new cases of oral cancer is diagnosed each year, and about 25% of those cases have no known risk factors, right? So it's really important that we kind of know the warning signs for oral cancer.
Well, so that's a pretty staggering number, and as you say, no warning signs or no, red flags there. So tell us a little bit about what is oral cancer, what we're talking about there, and then what are some of the risk factors?
Yeah, so oral cancer is kind of a generic term, but basically it is the most common form of cancer in both the head and the neck. It can be found in the gums, it can be found on the tongue, it can be found on the roof of your mouth, floor of your mouth, and it could look like swelling, it could look like a growth, it could look like a red patch, it could look like a white patch. It could look like a blister that doesn't want to heal, right? So it's kind of a wide spectrum there. So really kind of being cognizant of, what looks a little bit abnormal, right? When it comes to those warning signs, again, there's a whole variety of them, but the most common ones that we see that patients report are you might have a little bit of tenderness, maybe a little bit of numbness, some swelling, kind of in the neck, face, jaw. Sometimes, yeah, you notice that growth of those patches that I was mentioning, but sometimes it can be as simple as difficulty chewing, swallowing, speaking, or even hearing, right? And then most commonly, we also see either pain or loose teeth.
Okay, well, even hearing, that's really interesting. And so you said that, many people don't even have risk factors or they don't have red flags. And is it tied to genetics or really is it just kind of anybody is vulnerable?
Yeah, so like I said, 25% of Americans that get diagnosed with oral cancer don't have risk factors. So it can happen to anyone. In terms of the biggest risk factors, anytime we talk about cancer, genetics and family history does play a portion in it. However, kind of big things to remember is a lot of the factors and risks are kind of controllables. So Smoking is a huge one. Smoking cigarettes and even vaping, e-cigarettes, huge kind of risk for oral cancer. We don't want to forget about tobacco-free or smokeless tobacco products. So we're talking, chewing tobacco, dip. Right. In addition, excessive alcohol consumption can also lead to increased oral cancer and, being exposed to the sun, right? We have a huge kind of emphasis on, sunscreen, but making sure that those lips and like those outer areas are all protected by sunscreen. That's another big cause of oral cancer.
That was really interesting when I was reading the notes before chatting with you today. I never really had thought about that. I mean, obviously you want to protect your skin from the sun, but I had really not thought about the importance of doing it on your mouth as well. So that was really interesting. Let's talk about reducing those risks. Obviously, you just have mentioned some things that we can do to prevent it, but also getting oral exams regularly, I'm assuming would help to prevent it. And, tell us some more about that.
Yeah, so there's quite a few things we can do. So first thing, like I said, is, limiting smoking and alcohol. We want to make sure we're wearing sunscreen, a good nutritious diet, lots of water, keeping everything nice and hydrated is really good and important for oral cancer. Another thing that, is really helpful is getting vaccinated for HPV, human papillomavirus. That also has a component in oral cancer. And most importantly is being regular with the dental visits and your primary care physician. Those 6-month dental visits and those annual visits with your doctor, you really want to be asking about making sure that oral cancer screening is getting done to make sure that they're not missing anything.
Yeah. And so when we're talking about, getting those regular exams and doing those things, obviously those are great, but you mentioned some symptoms earlier. If we do start to see those symptoms, we need to get to the dentist as quickly as possible, I'm assuming. And you would go to the dentist first, is that correct?
Yes. So, a lot of times I've had patients that, they're brushing their teeth and they might have noticed something in their mouth or, they've been noticing some pain. You always want to be, kind of cognizant at home of making sure that you're watching your mouth, your lips, your cheeks, if anything's changing. But the minute you have any sort of symptoms or any questions, your primary dentist, your general dentist is probably going to be the point of contact. And he can kind of be the one to kind of get you referred, whether to see a doctor or an oral surgeon, wherever you need to go next. He'll kind of be your most likely your primary point of contact there.
Well, Dr. Mathai, thank you so much for being with us today. It's really interesting information and very important information, so we appreciate it.
Betsy, thank you so much. Appreciate your time.
Thanks to everyone on the show today for your insights and contributions. As always, our production team is behind the scenes to make all of this possible. And of course, we are honored that you have chosen to share a part of your day with us. I'm Betsy McDaniel, and we'll see you for the next WHHI-TV Daily News.